So listen, I know I'm a white lady, but Black health matters, and there are not enough people on this platform talking about Black women in general and the poor healthcare they receive. So I'm studying for a certification, and I want to read you this paragraph, okay? Here we go. Studies among African American women suggest that practitioners are not providing adequate information regarding menopause. Only 14% of African American women identified their healthcare provider as the primary source of information on menopause. 60% of these women identified their family and friends as a primary source, with literature at 20%. In contrast, most Caucasian American women, 67%, rely on literature as their primary source, with their healthcare provider at 17%. Okay, here's my rub. This social media app is a vehicle for change for women. I know there are some crazy creators on this, but so help me God, if people don't have time to read, if people don't have a good healthcare practitioner, if they can't even get to a health practitioner, if they don't even have insurance, this is why social media and conversations matter. And this is why me and every other person talking about perimenopause and menopause will fight to the ground to get information to women. And I'm going to say specifically, Black women need to know, because they are the most underserved population. Fight me on it. Fight me. It is terrible. And so when I was reading this, it makes me want to cry. Okay? Cry. So when I get people hating on me on this app, oh my God, I am crying. I am crying on TikTok for sharing information, and they say that we are not MDs. The MDs are drowning. Our healthcare system is drowning. And if there are a handful of people creating TikToks, getting wellness to the masses, let's say specifically Black women, and you're coming for us and saying, well, you're not an MD, what do you know? I have 3 degrees, multiple certifications. I'm sitting for another certification that will make me no money, but guess what? It will make me the highest level credential for a menopause provider. So I can be the most informed educator out there. And so when people come for me and say, well, you're just a PT, what do you know? Well, I probably know more than your healthcare provider, because I'm going for the highest certification. And reading that in my book to study made me freaking rage against the machine mad. There needs to be more people who are trained in perimenopause and menopause. And there need to be more people talking about Black health, because this is awful. Awful.